Porcelain restorations are sometimes necessary to do as a full crown. The two most common materials that we use for full crowns are Emax, or it's also called lithium disilicate, or on occasion sometimes we use zirconia. There's normally only two indications for full crowns. One is when the patient has had a root canal procedure. It's commonly recommended to do a full crown to protect the tooth from fracture. And also if the patient has had a dental implant, then they also need a full crown to replace the tooth that they're missing. In that case, normally it's a combination of a titanium zirconia material, which is very strong and holds up well in an implanted tooth, and the patient can eat whatever they like, frankly, for the rest of their life. They're successful over 95% of the time and allows the patient to function just as if they had a natural tooth.